One of the most important points to remember about the virus that causes COVID is that it's continually mutating and changing. And when it develops a mutation that makes it more infectious, within a month or two, that, what we call variant from the original virus, will take over as the most common infecting virus in the population. Starting in January of 2021, we had what's called the Alpha variant. This is about 50% more infectious than the original COVID strain. But fortunately, the vaccines work just as well against Alpha as they did against the original strain, about 95% effective. The other important point is if a vaccinated person became infected with COVID, they had very low amounts of virus in their, what we call the nasopharynx. So it was very unlikely that they would transmit the virus to another person. So this led the CDC in mid-May to change the recommendation and say if you were fully vaccinated, you didn't need to wear a mask indoors except in rare circumstances where it was very crowded. Now everything changed in June and July where we started to see a new strain or variant called Delta. Delta is about 50% more infectious than Alpha. If you're infected with Delta, you have 10 times more virus in your nasopharynx. You have 1,000 times more virus than the original strain that started this pandemic. The original strain would infect 2 to 3 people after the initial case. With Delta, it looks like 6 to 8 people get infected from each case. So a much more infectious virus. And the real problem is when a fully vaccinated person gets infected, they have an amount of virus very similar to people that have never been vaccinated. Now the vaccines still work very well against Delta. Pfizer and Moderna about 88% effective versus that original 95%. But the concern is this large amount of virus in fully vaccinated people. So this led again to the CDC to change their guidance. And what they said now is we really should return to wearing a mask indoors, even if fully vaccinated, and outdoors if there is a crowd.